So, we're here with Neela. She's been a patient here for 3 years now?
About a year and a half.
Year and a half, sorry. I
Yeah.
jump sometimes. You came initially with what was going on?
So,
This is part two of our, sorry, this is our
yeah.
part two of our video from about, I want to say after the first 3 or 4 months, this is our part two, a year and a half later.
Yeah. So she just had her routine physical exam with her primary pediatrician, and he noticed just a little worrisome areas for the scoliosis. Got the X-ray done, and she came back with about a 6-degree level of scoliosis. So he watched it for 6 months and then repeated it, and then it was 12 degrees.
So it's gone up.
So it went
worse.
up. It got worse. So at that point, he had just recommended watching because they don't really do anything until 15, 18, 20 degrees, somewhere around there. Then they would refer. I felt a little uncomfortable waiting and watching because I just felt like we were waiting for something bad to happen. You know, I just felt like if there was something that I could do or something that we could help her with, then it would be better as a, you know, for her or as a parent. I feel like I'm getting involved or doing something to help her.
And someone in the medical field too, as a health professional.
Right. I don't want to just sit there and wait for her to have something bad happen to her and just do nothing. So then I started researching, you know, some treatments for scoliosis, if they had some kind of braces or something to sleep in or something, you know, anything like that. And your site popped up, and I watched a couple of your videos and testimonies that the patients did about how it helped. And
like this, here.
So just like this, exactly.
Okay,
and so it seemed like something that we could do. You're local enough to us. It was simple enough to come here. So I thought, you know, it's not going to hurt anything. Let's try and see what's happening. So yeah, I think it's been about a year and a half. Okay. Actually, maybe this summer will be 2 years. So I'm coming up on that. But yeah, she's been doing good. She's been doing the exercises and everything. And I was just showing him that we had the 2018 x-rays from her pediatrician that showed her degrees had gotten up to 15.
So from 6 to 12 to 15, getting worse.
Right.
Okay.
And then the ones that we just had done last week, it had dropped down to 10. So definitely shows some improvement there. So that was very satisfying for me to see. It was satisfying, and you know, for her to see. She was very happy to see that because she has some fear and worry every now and then that what if it doesn't get better? Do I have to have surgery? I don't want to have to wear a brace. I don't want to have to do all those things like that. So that's why I tell her, you know, keep doing your exercises. Yeah. And then, so it was nice to see it come down. So that was very satisfying to do because I didn't want to see it go from 6 to 12 to 15, then to 20. And then at 20, they would send us to the orthopedic surgeon and then, you know, either brace her or do surgery or something. So if there's something else you can do, as simple as, you know, daily exercises, you know, weekly adjustments, something like that to help control it, you know, have her be conscious of her posture, the way she's sitting, you know, to make sure that she's, you know, holding her frame properly, then that seems to be the best thing that we could do for her. And so it is very, you know, it was very satisfying to get that report back last week that said that it's improving.
But it took a year and a half, almost 2 years to get there.
Right.
You guys came in, did the hard work to see the improvement, but it came in, got the treatment, got the spinal correction, seeing that x-rays improved, the degrees improved too. Yeah. But also, what are you doing now, Neela, on a daily basis to maintain it?
I'm doing my exercises 2 times a day. Mm-hmm. And then like every once in a while, I'll do it 3 times a day. Wow.
So you've done the hard work at home, not in the office, to do it every day. And you said, I keep getting confused how old you are.
14.
Good. So that part, as far as young as you are, you're mature enough to understand, it's up to me to do this, to keep my body healthy. Next, scoliosis will is a possibility to improve or get worse by the time you're 21, 22. So by doing this, about 20 thing. So at that point, doing your routine every day, twice a day, sometimes 3 times a day, maintains your health, maintains the degree to a lower level, so you don't have problems with bracing and surgery down the line. So you're out of that range completely. Are you happy with that?
Yeah.
Mom, you happy with that?
Yeah, so I think, you know, I think she's right on track. I think she feels comfortable with it, and I think, you know, we have a long-term plan. So like we just learned today, you know, she'll have to do this till 21 or so. Yeah. You know, so I think getting into that good habit, keeping her posture going straight and everything. So
you do it at home. At that point, we see you very infrequent here. At that point, it keeps things at bay. If something happens where it goes from 10 to 12, we'll catch it right away, get you back down to 10 again. The 10 is where it's very manageable, will not affect you when you're an adult. Yeah. All right, anything else?
No, I think that's it. So
well, good, you did commitment, you did the work.
Yeah. Just keep, just have her keep doing her.
That's it.
for exercises.
Well, thanks for you again at Chiropractic Clinic for Chiropractic in Upland, Claremont, Cucamonga. Thanks for watching again. Happy Friday.